Hello, good afternoon. My name is Andrew. I will be your RN for today. Quick question, what is your name and date of birth by chance? Robert Sanchez. Perfect. Can I see your wristband real quick to confirm? Perfect, it lines up. Well, the reason why I'm here today is to install an NG tube for you. Basically, an NG tube is basically a tube that goes through your nose, down your throat, and into your stomach, and serves two purposes. One is to, of course, administer medications, as well as to remove any gastric contents from your actual intestine itself, as well as for feeding purposes, which is pretty cool. And basically, the goal for today is to install this in the best way possible. And please feel free to let me know if you experience any discomfort, any pain whatsoever while doing this process, and if you consent to this process. Do you consent to this process? Yes, I do. Perfecto mundo. Well, first I'll begin by actually applying my gloves first, of course. Don't you worry, I already applied hand hygiene. Perfect, okay. Okay, before we begin, I'm gonna place this handkerchief on you to, in case you vomit or if anything comes out of your mouth. Sound fair enough? Sound fair enough. Perfect. Okay, now I'll have to begin by measuring the actual NG tube to fit your size and dimensions. Perfect? Perfect. Okay. So what I'm going to do is, of course, there you go, line it up with your nostril right here. Perfect. Bingo, of course, right here. So ear hole, nose hole all the way to ear hole, and all the way down to right here. Perfect. And from here, then we will go down all the way to your xiphoid process, which should be right about here. It's absolutely awesome. Perfect. So I've officially measured the NG tube. Just to confirm one more time. Boom. Check. Check. Perfecto mundo. Boom. Boom. Check. Perfect. Perfect. All the way down to your xiphoid process. Perfect. Okay, let me mark that for you real quick with some handy dandy tape. Perfecto mundo. There you go. Okay, I'll adjust you up to a high quality position. Perfect. Before we begin, I'm gonna lubricate the tip of the NG tube to make it easy to go in. Perfect. Again, please let me know if you experience any discomfort. Perfect. Okay. So what I'm gonna do is put the first 3 inches into your mouth, or about the first 3 inches or so, into your nose. In order for it to touch the back of your mouth, you'll feel it when we get there. And once we get there, once we get there, I'm gonna ask you to, of course, swallow repeatedly until I have fully installed the NG tube into your stomach. Sound fair enough? Sound fair enough. But before we begin, we gotta put you in a high voltage position right here, super high voltage position, and then put it right here. First 2 inches, bam, you should feel it in the back of your tongue. Now what I want you to do is swallow repeatedly until I finish installing the tube. Perfect? Perfect. Awesome, you're doing good. Almost done, come on, let's go, I believe in you. Of course. Bingo, almost done, almost there, come on, let's go, let's go. And we're there, perfect. Now I'll put you back down real quick, slowly. Good job, good job. You did an awesome job, perfect. Well, the NG tube is fully installed, but I've got the tape to fully secure it in its spot. Perfect. Fully attached, good job. Now I want you to take an X-ray to fully confirm. Now I will take an X-ray. Now I will take a chest X-ray in order to fully confirm that the NG tube has been successfully placed in your stomach. Perfect. The chest X-ray has confirmed that the NG tube is properly placed. Good job. Mr. Esquivel, I wanted to take the NG tube off as soon as possible. He's going to surgery. Sounds good. Well, right now we're going to remove the NG tube we just installed. Sound fair enough? Sound fair enough. To do this, what I'm going to do is, of course, lower the head little by little, of course, perfect. And I'm going to take your tape off real quick, okay? I'll give you further instructions once we get there. Perfect. Good job, of course. So what we're going to do now is remove the NG tube. When you remove the NG tube, I want you to do me a huge favor. I want you to take a deep breath when I tell you to, and hold as long as possible until I have finished removing the NG tube from your body. Sound fair enough? Perfect. Perfect. On 3. 1, 2, 3. Take a deep breath, hold it in, and keep on holding it. Good job. Hold, 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 hold. Almost there, almost there. Hold, hold, hold. Good job. Hold, 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 hold. And almost there, almost there, almost there. Boom, bam, there you go. We have successfully placed and inserted. We have successfully placed and removed an NG tube. Well, hope you had an awesome time. And thank you for watching. Boom. Bam. I'll clean you up real quick, and bam, there you go.